Morning, everyone, and welcome back. Earlier this week, Governor Ricketts declared January as Human Trafficking Awareness Month in the state. Now, this month is dedicated to raise awareness and educate the public on how to identify and prevent this crime. Here to speak with us today is Market Manager for Forensic Nursing, Jody Hayes from CHI Health. Jody, good morning.
Good morning.
So when people talk about human trafficking, they mostly think about big cities. So why is this a problem here, and how is CHI combating it?
So CHI is committed to educating our healthcare providers and those within our community about human trafficking. And leadership at St. Elizabeth was instrumental in ensuring that all of our employees across the state of Nebraska and Southwest Iowa have yearly trainings related to human trafficking, trauma-informed care, and additional training topics that were able to help identify victims of violence and then how to properly care for them. And our forensic nurse examiner program has identified over 45 survivors of human trafficking in the last few years.
Now, CHI did receive a grant, and how are those funds being utilized at St. Elizabeth's?
So CHI's Mission and Ministry Fund grant has allowed for the development of a specific task force at St. Elizabeth and Nebraska Heart. And this task force has held and continues to hold a monthly learning series that collaborates with community partners such as the Nebraska Attorney General's Office, the Nebraska State Patrol, and community advocacy groups focusing on violence prevention, victim services, and other topics related to identifying victims and providing care.
Well, how many people has that task force helped out?
So through the education, the task force has helped educate over 10,000 medical professionals and numerous community groups and organizations that can in turn help identify and support our victims of trafficking.
So what are some things like nurses, when somebody comes in, let's say, with some injuries maybe, what are some things nurses are looking for to identify and, maybe take care of that human trafficking issue? So
the nurses aren't, well, more than likely a patient is not going to present to our hospital and disclose that they're a trafficking victim. They may disclose a history of abuse along with observable signs of trafficking that then allows our nurse to listen to not only the things that the patient is saying, but also to those things that the patient is not saying, and asking those additional questions related to their injury or their diagnosis. But most importantly, what our nurses can do is offer every patient that they come in contact with the knowledge and the resources that are available related to the violence prevention.
Alrighty, sounds good. We have Jody Hayes with CHI Health joining us to talk human trafficking, obviously an important topic this morning. Thank you very much, Jody.
Thank you.
All right, we'll be right back after the break, everyone. Stick with us.